Halitosis. Definition. Bad breath, also known as halitosis, is a symptom in which a noticeably unpleasant breath odor is present. Bad breath, medically called halitosis, can result from poor dental health habits and may be a sign of other health problems. Causes. Potential causes of bad breath include tobacco. Tobacco products cause their own types of mouth odor. Additionally, they increase the chances of gum disease, which can also cause bad breath. Food. The breakdown of food particles stuck in the teeth can cause odors. Some foods such as onions and garlic can also cause bad breath. After they are digested, their breakdown products are carried in the blood to the lungs where they can affect the breath. Dry mouth. Saliva naturally cleans the mouth. If the mouth is naturally dry or dry due to a specific disease, such as xerostomy, odors can build up. Dental hygiene. Brushing and flossing ensure the removal of small particles of food that can build up and slowly break down, producing odor. A film of bacteria called plaque builds up if brushing is not regular. This plaque can irritate the gums and cause inflammation between the teeth and gums called periodontitis. Dentures that are not cleaned regularly or properly can also harbor bacteria that cause halitosis. Crash diets, fasting and low-carbohydrate eating programs can produce halitosis. This is due to the breakdown of fats producing chemicals called ketones. These ketones have a strong aroma. Drugs. Certain medications can reduce saliva and, therefore, increase odors. Other drugs can produce odors as they break down and release chemicals in the breath. Examples include nitrates used to treat angina, some chemotherapy chemicals, and some tranquilizers, such as phenothiazines. Individuals who take vitamin supplements in large doses can also be prone to bad breath. Mouth, nose, and throat conditions. Sometimes, small, bacteria-covered stones can form on the tonsils at the back of the throat and produce odor. Also, infections or inflammation in the nose, throat, or sinuses can cause halitosis. Foreign body. Bad breath can be caused if they have a foreign body lodged in their nasal cavity, especially in children. Diseases. Some cancers, liver failure, and other metabolic diseases can cause halitosis, due to the specific mixes of chemicals that they produce. Gastroesophageal reflux disease, GERD, can cause bad breath due to the regular reflux of stomach acids. Rarer causes of bad breath. As mentioned earlier, the most common reason for bad breath is oral hygiene, but other situations can also be to blame. Rarer causes of bad breath include ketoacidosis. When the insulin levels of a person with diabetes are very low, their bodies can no longer use sugar and begin to use fat stores instead. When fat is broken down, ketones are produced and build up. Ketones can be poisonous when found in large numbers and produce a distinctive and unpleasant breath odor. Ketoacidosis is a serious and potentially life-threatening condition. Bowel obstruction. Breath can smell like feces if there has been a prolonged period of vomiting, especially if a bowel obstruction is present. Bronchiectasis. This is a long-term condition in which airways become wider than normal, allowing for a buildup of mucus that leads to bad breath. Aspiration pneumonia. A swelling or infection in the lungs or airways due to inhaling vomit, saliva, food, or liquids. Symptoms. Bad breath is when a noticeably unpleasant odor is believed to be present on the breath. It can result in anxiety among those affected. It is also associated with depression and symptoms of obsessive-compulsive disorder. Diagnosis. Often, a dentist will simply smell the breath of a person with suspected halitosis and rate the odor on a 6-point intensity scale. The dentist may scrape the back of the tongue and smell the scrapings, as this area can often be a source of the aroma. There are a variety of sophisticated detectors that can rate odor more precisely. They include the following. Halimeter. This detects low levels of sulfur. Gas chromatography. This test measures 3 volatile sulfur compounds, hydrogen sulfide, methyl mercaptan, and dimethyl sulfide. Banner test. This measures levels of a specific enzyme produced by halitosis-causing bacteria. Beta-galactosidase test. Levels of the enzyme beta-galactosidase have been found to correlate with mouth odor. Treatment. Treatment depends mainly on the cause of the condition, including poor oral health care. If the bad breath is due to improper oral health care, in most cases the dentist will treat the cause of the problem. Gum disease. If the cause is an underlying gum disease, the condition may be treated by the dentist. Or client may be referred to an oral specialist, in most cases, a periodontist. A periodontal cleaning often helps to remove the bacteria and tartar or plaque that has built up and is causing inflammation at the gum line. Extensive plaque buildup. The dentist or periodontist may recommend an antimicrobial mouth rinse, Listerine, Hecadine, Betadine gargle. Also, client may be told to brush the tongue gently each time client brushed the teeth to help remove odor-causing bacteria. Health condition. Diagnosis and treatment of an existing health condition may get rid of the bad breath. Prevention. Other lifestyle changes and home remedies for bad breath include: brush the teeth. Be sure to brush at least twice a day, preferably after each meal. Floss. Flossing reduces the buildup of food particles and plaque from between the teeth. Brushing only cleans around 60% of the surface of the tooth. Clean dentures. Anything that goes into the mouth, including dentures, a bridge, or a mouth guard, should be cleaned as recommended on a daily basis. Cleaning prevents the bacteria from building up and being transferred back into the mouth. Changing toothbrush every 2 to 3 months is also important for similar reasons. Brush tongue. Bacteria, food, and dead cells commonly build up on the tongue, especially in smokers or those with a particularly dry mouth. A tongue scraper can sometimes be useful. Avoid dry mouth. Drink plenty of water. Avoid alcohol and tobacco, both of which dehydrate the mouth. Chewing gum or sucking a sweet, preferably sugar-free, can help stimulate the production of saliva. If the mouth is chronically dry, a doctor may prescribe medication that stimulates the flow of saliva. Diet. Avoid onions, garlic, and spicy food. Sugary foods are also linked to bad breath. Reduce coffee and alcohol consumption. Eating a breakfast that includes rough foods can help clean the back of the tongue.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.